I'm John McCullough from positivelight.com, and we're here in Toronto today at the annual research conference of the Ontario HIV Treatment Network. And my guest today is Lisa Power. Hi, Lisa.
Hi.
Welcome to Toronto.
Thank you.
Lisa, you're the policy director at the Terence Higgins Trust in the UK, and you're here as part of a plenary session panel today on HIV and aging. But before we talk about that, could you just, for those of us who may not be aware of the work of the Terence Higgins Trust, could you, in a nutshell, just tell us what the agency does?
Well, Terence Higgins Trust is the biggest and the oldest HIV non-governmental organisation or charity in the UK. It's our 30th anniversary this year, 30 years since Terry died and 30 years since we were founded. And we do all kinds of work around HIV and sexual health, from public awareness through targeted prevention to testing, treatment for minor STIs and long-term support for people living with HIV. We have a membership of over 9,000 people, of whom half are people living with HIV.
Right. And unlike AIDS service organisations in Canada, you're nationwide. You work throughout the country.
We work across England, Scotland and Wales, although the majority of our services are in England. And certainly we do a lot of work in London, the capital, because half of all people with HIV are still living and getting services in and around the capital.
I see. Well, later today, you're going to be a panelist at a plenary session on HIV and aging. And we're certainly here in Canada seeing a greying of the HIV population, partly because of the effectiveness of antiretroviral medication, but also because people increasingly are being diagnosed later in life. And the median age, I understand, of people living with HIV in Ontario at the moment is 40. So we anticipate within the next decade that the majority of people in this province with HIV will be over 50. And I know that that's an area that you have particular interest in the UK, in your work there. So I wonder if you could maybe set the scene for us a little bit and tell us what are some of the challenges of aging with HIV.
Well, we have a similar situation in the UK. Median age of diagnosis is in people's 30s or even early 40s. And we have a similarly ageing epidemic, largely due to treatment considerations. And this was borne home to me 3 or 4 years ago, when there were some very big changes in our benefits system. And I realised that there was a rump of long-term surviving people with HIV, mostly gay men, who were about to lose all of their state benefits and who had made no provision for old age. They weren't expecting to live to old age. And that really brought it into sharp relief. So we went out to find out what was really going on with older people living with HIV, and we did a piece of research called 50+.
Right. So obviously part of that research would be the whole issue of financial security, but I imagine there are a lot of other issues that people aging with HIV must be concerned about.
Well, we've now, one of the major projects we have now as a result of that research is called the Health, Wealth and Happiness Project. And it's kind of what everybody wants in life, is health, wealth and happiness. But we found that the problems for people living longer with HIV were around physical and mental health. There are the obvious physical issues of either you've been diagnosed late or you've been managing on suboptimal treatments or on a string of different treatments before you got to the really good treatments we have now. You have a lot of mental health issues, low-grade depression, not major mental health problems often, but social isolation, stigma, loss of your social network has often happened. So there was a real issue there for people. There were the financial issues, which were obvious around people who, frankly, had been advised quite often to leave their job, cash in their pension, go around the world because they weren't going to live to see their old age, and now they are. And also the difficulties for people who might have stayed working but have lost promotion because of significant ill health or because of stigma, or who simply couldn't get financial products, who don't have a private pension and things like that, who don't have life insurance and so on, because of the way that the financial products industry has behaved around HIV.
Right.
And we looked at that in terms of health, wealth and happiness, managing to get people the same lives as their contemporaries. How do we do that?
Right.
You know, how do we ensure that there is no stigma which operates to give them a lesser life than other people?
Right. So as an organisation that's working with people living with HIV, including people aging with HIV, I know you have some thoughts about how your agency has changed or needs to change, which will be applicable, I think, probably to similar organisations in Canada and elsewhere. Could you share with us a little bit about some of the changes that your organisation is making to address the needs of this population along the lines you've talked about?
Well, I think there are two things that need to be done. One of them, I think a lot of people have picked up on, which is obvious, which is making life better for people who are ageing with HIV now. And that involves working with other aid organisations for older people, actually waking those organisations up, waking support services, social care and so on, up to the needs of people with HIV who are going to be living into older age. There were significant fears from the people we surveyed about having to go into homes that might not understand either HIV or, for the gay men, not understand LGBT issues. There were significant worries about home carers, home helps, and some evidence that there was prejudice operating in that area, which was disadvantaging people. But I think the other area which people haven't thought through yet is how do we change all our other support services to actually genuinely reflect that HIV is now a long-term condition? And how do we prevent future generations or younger people diagnosed with HIV encountering the same level of difficulties that we're seeing in the current generation of people over 50 with HIV? How do we keep people more physically fit, with less comorbidities, with better financial padding, with more secure housing, all of those things, and better social networks. Social networks are absolutely key, and disclosure is key to that. Actually having people who support you as you are and not as you might pretend to be, without disclosing HIV.
Right. So, Lisa, it seems to me there's probably two approaches there. One is helping people living with HIV, even if they're newly diagnosed and young, to plan for the future, but also, as you've indicated, helping those who work with older people living with HIV, including gay men, to understand what that is. I mean, I know that one of the issues here in Canada is that geriatricians don't often understand HIV, and HIV physicians don't often understand aging. So there's a lot of education that needs to be done too. So that's part of your mandate?
Yeah. In the UK system, most people who are older use their GP, their general practitioner, their family doctor, a lot more. And there's a history in the UK of people with HIV not always disclosing to their family doctor that they have HIV. So there's a lot of work to be done in bringing GPs on board and getting them to understand the interaction between ageing and HIV, because they're going to be needed in that. There's a lot of work to be done with other clinicians, other hospital departments, particularly the high-level comorbidities where they really haven't thought enough of this through around ageing, stuff around heart, stuff around liver, all of those things. So there's a lot of work to be done with clinical networks, and that's starting to take place. But I think there is not enough being done to understand the social side of things. There's a real issue, I think, around the social interaction, the social issues that we don't take account of, because a lot of older people suffer from social isolation anyway.
Right.
And if you're someone who has lost a lot of your friends to the virus, if you are someone who maybe has felt constrained from making a lot of friendships by the stigma against HIV in society, you may really have lost a lot of that. So a lot of the work we're doing now is actually about working to help people relearn and regain those social networks if they've worked themselves into a position of isolation, which I think a lot of older people with HIV, be they gay, be they African, be they white heterosexuals, that they have, a lot of people have isolated themselves, and now they're going to live another 30 or 40 years. So that's not a healthy place to be.
So exactly. So Lisa, do you do this like a one-on-one work, or in groups, or through your website, or how does that message get out to people?
Well, there's a range of things. I mean, one of the things is you do the research, you get the findings, and you kind of want it all to change overnight after that. And that doesn't happen. It takes a couple of years to turn stuff around. And some of that is about actually getting funding to do the new work. We were very lucky in that we got these findings as we were putting together a new online community for people living with HIV, which is called My HIV, and we were able to
myhiv.org, I think.
myhiv.org .uk, I think. myhiv.org UK. And people can look at it. I think it's absolutely fine if you're positive and from Canada to join it now, but you may be asked to fake a UK postcode.
I see. Okay. Fine.
So
just try it.
Yeah. But it has a good online community. It has discussion boards. It has an awful lot of stuff which is around maintaining your health. It has health checks, so you can see your progress as you grapple with the issues that you identify as you're needing to work on. So we were able to incorporate some of our findings into that, but we've had to go out and find the money for the Health, Wealth and Happiness project, for some more work looking at housing and older people, things like that. So those things are just starting to come online now.
Right. And do you actually provide direct service to people through like groups of men and other people living with HIV?
Well, what we're planning with the Health, Wealth and Happiness project is that's got two components, and one is the financial component, which is that there is a specialist advisor who will be working with anybody who's over 50 living with HIV on either working to ensure they get the benefits they're entitled to, or working on maximising their ability to manage their money if they're in work, or they already have their benefits, actually working to make sure that they manage on the money that they've got. So there's the money management and financial stuff there. On the other side of it, we're working both with groups of people and with individual one-to-one work, a kind of community support volunteer work where we're getting people who are 50 plus with HIV, but who are socially skilled, who are already volunteering for us quite often, getting them to work with other older adults with HIV. So it's a peer-to-peer support system, and we started out with that being just the idea being one-to-one, and we're now developing it because we've looked at some other work that's going on in San Francisco, and we've recognised that group work has quite a big role to play in sustainable social networks.
Right. Well, this is very exciting, Lisa, and I think creative thinking on the part of your organisation, and a lot of what you're doing in the UK, I think, is very applicable to us here in Canada. So I want to thank you very much for taking the time from your busy schedule to talk with us here today about your work at the Terence Higgins Trust.
I just want to say one more thing to you, which I think is really key. All of this happened with really high levels of involvement of people with HIV aged 50 and over. Excellent. In fact, one of the difficulties we faced was we had lots of people who were willing to say they had HIV, but a lot of them didn't want to admit they were aged over 50.
Yes.
So that was the difficulty in recruitment, but it's absolutely key, and it has been key all the way through, as you will know from everything you do.
Absolutely.
This isn't something done to, it's done with.
Absolutely, that is the way to go. Well, thank you again, Lisa, very much for talking with us. And I'm for the OHTN and PositiveLife.com, I'm John McCullough.